Last night in Roxbury, Metco parents voiced concerns over an expansion of drug treatment programs by the Dimmick Center. At issue is the building on Dimmick Street used by Metco for administration and tutoring. The building also has an outpatient addiction program. Dimmick plans a detox facility in the basement with space for Metco on the second floor.
I don't see why in the whole city of Boston, Dimmick, 40 Dimmick is the only place that you can put these patients.
We have these programs at a lot of places in Boston, and you can always tell because of the amount of people hanging out, the crimes that occur, the violence, the domestic violence.
Dimmick is doing everything it can to enhance the security and safety of the building. We're creating separate entrances for our detox clients. We are making sure that the entryway to the building will not be used by the clients at all, and we are reconfiguring the building such that the clients and children will never come into contact with one another.
Name me a town or a place that such a combination is working right now, an educational program and a rehab program in the same building.
There's never been a security issue involving our clients and our kids. And we have increased our security because we need to, because we're dealing with people that have had violent histories in the past. We screen the people that come to our campus to make sure there are no sex offenders on our campus. I have 400 kids outside of the Metco kids that I need to protect every day. So I'm going to increase the security because that's what we need to do. But at the same time, I'm going to meet the community needs for behavioral health and substance abuse.
So it's not a question of money, it's a question of power. You have the power to send us on our way, even though we have stuck with you through thick and thin for 43 years.
We want Metco to be part of the fabric of who we are, but if the Metco community does not want that and does not want their kids in this environment, which it is and will always be, because we're responding to what the community needs, then it would be up to the leadership to make a decision about leveraging the community, finding another location, raising funds for another location, and finding a rate that is affordable to the Metco program.
And joining us from the Dimock Center is the president and CEO, Maicha Minter-Jordan. Thank you very much for being with us.
Thank you for having me.
This was a contentious meeting last night, but walk us back to the situation, because this isn't about people talking about things they knew. Some of them, I guess, they didn't know what was going on.
Yes, I think part of my goal in the meeting that we had with the parents and the Metco staff as well as Metco board members was to make sure that we started off at a point of common understanding. And I think what has not been readily apparent to many of the people that were there last night was that the current state of who Dimmick is a very comprehensive, holistic organization that includes behavioral health, primary care, substance abuse services, as well as early education. And that's been our model of care since we were in existence since 1969. Part of what was misunderstood, I believe, was that there are programs in 7 of our 9 buildings that address behavioral health that includes substance abuse and mental health. And the building that Metco currently leases from us has one of those substance abuse programs in the basement. So this has been the current state of having a behavioral health and substance abuse program in the building that Metco leases space in. And to date, we've had no incidents on our campus between any children, either in our Head Start, Early Head Start, or preschool program, or Metco children and our addicted clients and patients who are really struggling and working on recovery. Never had a security incident, and as part of the plan to move our inpatient detox into the basement floor of that building temporarily, I will add, is to enhance security, to make sure that there are no incidents. And I think in hearing that and hearing what part of our plan is regarding security, our commitment to the Metco program, they've been at a rate for their lease since 1987. We're going to continue that rate. We're really investing a lot into accommodating the Metco program, understanding that this is a difficult move, it's a difficult time, but also understanding that we have time constraints around our capital project. I think the parents heard that and they understood that Dimmick is really doing a lot to accommodate, understanding and that this is not an ideal time for this to happen, but that we're willing to work with the Metco board and its staff to make sure that we're being reasonable and fair as we move forward.
Well, as you mentioned, there haven't been any serious incidents of harm to children, but I think one thing I picked up from comments at the meeting is that people, they weren't comfortable with what's going on there.
So I think part of the decision that needs to be made by the Metco board and its staff is A, what are Metco's plans for growth and for space? And B, does Metco want to be in the environment that Dimmick has? And Dimmick and Metco have been in partnership for over 40 years. And it's been a wonderful partnership, and all of those programs have existed on our campus. It coexisted with the Metco program. So I think now that there's a better understanding from the Metco community, and I will add that I too am a Metco parent, but now that there's a better understanding in the community, there's a decision that needs to be made whether or not we will continue to peacefully coexist or whether or not Metco will find a location elsewhere. But as I explained last night and am committed to, Metco will always have a home on our campus. We have education programs. We have a preschool, a Head Start, early Head Start, over 400 children on our campus every day outside of the Metco program. So early education is important to us, and it's a commitment that we'll make to Metco as long as Metco would like to stay.
Talk about the people you serve, because we heard about them at the meeting described in a worst case kind of fashion, but you tell me who they are, because sometimes we have these people in the neighborhood saying, my God, the detox population, they're coming in from some other community that doesn't want to deal with them.
I mean, I think that we've seen that across the city. In my work with the Mayor's Task Force, we identified that there are people that come from outside of Boston to seek services within Boston. And Dimmick has one of two detoxes in the city. So while there may be people in the program that don't look like me, the vast predominance of the clients that utilize our program are from our community and look like me. They're Black and brown people that utilize our detox, our halfway houses, our outpatient addiction services that are currently in the building that Metco leases. And so what I explained in the meeting last night is that this is our community, and we're treating our community holistically with all of the components that I outlined in terms of primary care, education, adult ed. We also have adult ed. I neglected to mention that, as well as the behavioral health programs. That's who Dimmick is. That's our model of care. And we're welcome to have Metco be a part of that, of our campus. And we'll embrace the opportunity to continue the partnership. And moreover, really embrace the opportunity to celebrate the fact that we've been able to garner support from our legislators, from our previous governor, from our donor base, to run a successful capital campaign and celebrate the fact that we're able to break ground this summer or early spring to renovate our detox and add more beds at such a critical time where there are people dying every day across the Commonwealth.
What about the tutoring of Metco students? Because it seems that there might be a need to relocate that to make things work.
So part of the proposal was to enhance the security of the building such that if Metco decides to stay in the building, that there is space for tutorial to occur within the second floor of our building. Part of my initial meetings with the Metco staff was to understand how many students they have, how many staff members they have, and then we brought in our architects at Dimmick's cost to plan the space for Metco to accommodate all of their programmatic needs. In addition to that, I've made other space on the campus available to them should they decide they wanted to move the children out for tutorial services. But in the current construct, they have space as per their requirements that they explained to me within the current second floor that's being offered to them. But they also can utilize this additional space. They are going to evaluate that space, as my understanding, to determine whether or not it meets their needs. And then they could acquire other space on our campus temporarily at no additional cost to use for tutorial services.
You were facing all this pressure at the meeting, and understandably from Metco parents.
Sure.
But on the other hand, talk about the other kind of pressure here, the crisis.
Yes.
And the need for drug treatment.
I mean, I think we hear about it every day in the news, that there are people dying, that there is unmet need, that there are not enough beds to treat the number of people that are afflicted with addiction, and it is a disease. And so Dimmick has the ability to, given that we've had the incredible support of our donor base and legislators, et cetera, to renovate our detox and add additional beds. So we're going from treating 3,000 clients a year to 4,000 clients a year with this expansion. So we're renovating and expanding in order to meet the need, and there is an urgency around that. There's an urgency in that we need to stop these lives from being lost. There's an urgency in terms of the construct of our financing, and that's part of what has been driving the time frame around the move. And then there's an urgency for us to get this building up and running so that we can serve people in the greatest capacity that we can.
Thank you very much for being with us.
Thank you for having me.
Dr. Maisha
Yes.
Minter-Jordan.
Thank you so much.
From the Dimmick Center. Still to come, leaders press for stronger response to complaints about racism at Boston Latin. But first, this message.